whatever treatments are right, whatever vaccines, that we're prepared to have everyone get them.
What didn't necessarily have to take time was using off-the-shelf drugs for early treatment. But yet somehow, I guess it's because President Trump allowed the word hydroxychloroquine.
Mr. Chairman, I've gone over my time as well, but I like to think of it, we don't live in a vacuum, so there's other things that are going to help us succeed, and I want to be sure that we look at those, so whatever treatments are right, whatever vaccines, that we're prepared to have everyone get them and be able to get through this pandemic together as a country. Thank you.
Well, thank you, Senator Rosen. I've got a number of questions that I'll continue to ask. I think the point about testing, I think everybody agrees it would have been great to have hundreds of millions of tests available day one, but it's just not practical. It didn't happen. This isn't Star Trek where you just say computer, 300 million tests. So it's taken time. What didn't necessarily have to take time was using off-the-shelf drugs for early treatment. But yet somehow, I guess it's because President Trump allowed the word hydroxychloroquine to flow off his, out of his mouth, all of a sudden that was attacked and that was poisoned. And we never, ever had the NIH, CDC, FDA put their full weight behind an investigation of that. The full clinical trials. I was pushing for that. Not pushing hydroxychloroquine, pushing for the science, for studies. But it never happened because, again, it was censored. We talked about disinformation. Not providing the public information is disinformation as well. So again, why I fault the agencies is because they turned a blind eye toward simple, cheap, possibly effective treatments that, by the way, created no harm. Dr. Risch, I think you mentioned, and I've got a lot to go over here. You mentioned that the non-randomized trials, I guess we'd call that observational studies, real-world experience, really involving thousands of patients, indicated that there was a 50% reduction in hospitalization deaths. In the Saudi Arabian study, 5-time reduction. Now let's just assume that that's true. I think we can also take a look at the billions of doses a year that are prescribed with hydroxychloroquine. Any member of Congress who's gone to Africa, they've just been handed hydroxychloroquine as an anti-malarial. We treat lupus, we treat rheumatoid arthritis. We don't give EKGs before that. The studies I saw early on were designed to fail on hydroxychloroquine, late in treatment, when people were basically ready to die, or when their heart was already affected by the virus. Of course, hydroxychloroquine does have an impact on arrhythmia at that late stage, but not early, which is when it was being recommended for early use, first 5 days. So when you take a look at the risk-reward, now that these other observational non-randomized trials studies have been conducted, 50% or 5-fold reduction in death and hospitalization versus the almost infinitesimal risk of hydroxychloroquine and zinc, this has made no sense to me whatsoever. The only explanation is the politicization of it, which I opened up my opening comments saying that has been what's such a shame. I do want to, before I forget, I received a letter and an article from the Economic Standard submitted by Dr. Stephen Hatfill. The letter kind of explains what I have known about a whistleblower, Dr. Rick Bright, who was asked by his superiors to work on establishing an FDA expanded access investigational new drug protocol. But by his insubordination, he instead went to Janet Woodcock and people in the FDA and got the emergency use authorization, which sounds like, hey, we're going to expand the use of this. No, he dramatically restricted the use of hydroxychloroquine only in hospital, when I think we all recognize it's probably not particularly effective, possibly dangerous, and only out of the national stockpile. He knew what he was doing. That's what poisoned the well. That's what created what I've called the prescription logjam here. on hydroxychloroquine or early, and I think it affected all early treatment options. It took them off the table. We took our eye off the ball. That's why I say our agencies failed us. These individuals in these agencies failed us. And here's the question I want to ask for you, Dr. McCullough, because you mentioned this. The circle of empathy. Can you just talk about how you described that to me before the hearing?
Let me just say, before I answer that this is not just a government culpability and malfeasance with respect to hydroxychloroquine. This is academic malfeasance. There were 2 fraudulent papers, one in the New England Journal of Medicine, one in Lancet, published by individuals interested in doing evil to the world with respect to a beneficial treatment of hydroxychloroquine. In an unprecedented manner, these 2 manuscripts were withdrawn after 2 weeks where they could scare the public and the world's physician audience. Since that time, there have been dozens of fraudulent papers.
Re-emphasize that. They were then withdrawn.
They were withdrawn, and the New England Journal of Medicine and Lancet acknowledged that they were fraudulent papers. They were scare papers to scare people on hydroxychloroquine. Since that time, there's been dozens of pile-on scare tactics in academics. This isn't the government. This is people in my field, in academic medicine, who are committing academic fraud. I reviewed a paper. I'm a cardiologist. I reviewed a paper that made it into the medical literature demonstrating that hydroxychloroquine causes a heart attack, that hydroxychloroquine causes a giant scar in the heart. And I can tell you, I'm at Baylor in Dallas. We have the world's most recognized cardiac pathology program in the world. Our senior examiner has held in his hands more human hearts than anybody in the history of mankind. I can tell you firsthand, hydroxychloroquine does not cause giant scars in the heart. So academic medicine is committing a fraud, is committing, I think, a crime against humanity. There must be a motivation behind this that's much bigger than just Democrat versus Republican. I am extremely concerned, honestly, about the academic contribution to scare tactics in the world. Now, it's not working everywhere. In India, it's given first line. And India is such a crowded country. I've been there myself. Their deaths per million population is a tiny fraction of America. If you're in Greece right now,
isn't it 95 versus over 700?
Yeah, so we have...
And they're using hydroxychloroquine.
Right, we have nearly 800 deaths per million population in the United States, and we're all spread out. In India, they're on top of each other. They have less than 100 deaths per million population. The leading doctor in India is willing to come testify to the United States and tell you the reason why. They have tons of COVID. It's spreading over like crazy, but they're treating it at home with hydroxychloroquine and other drugs. Remember, it's a multi-drug program, probably about four or so drugs plus supplements, and they've handled the infection. Greece, everyone's been traveled in Europe. Greece is not a third world country. First line, you're given hydroxychloroquine. Okay, we've missed the ball. There's 30 countries that have approved an oral version of remdesivir called favipiravir. 30 countries, including Japan. Every country that is actually having a reasonable public health response is treating this problem at home. Now, none of these drugs are a cure, but they allow the patient to get through the illness. Like myself, I missed 10 days off of work, and I returned to the workforce. I didn't get in the hospital for 4 weeks. They allow people to stay at home and not go out and contaminate other people. My wife and I got it at the same time, and because we were treated at home, we were actually able to stay at home so we didn't contaminate other people. The current program that's supported by the Minority Witness and the National Institutes of Health and all government bodies is that patients go home, they get no help whatsoever, doctors are not supposed to treat them, they go out in a panic to urgent cares and ERs, contaminate more people, and then they're hospitalized and die. America has to wake up right here, right now. We are getting buried, and we need home treatment.
Okay, Dr. Jha, let me have you jump in here. We've got Dr. McCullough, again, Vice Chair of Medicine at Baylor, I believe Harvard trained. Dr. Harvey Risch, trained at Yale. Dr. Freed, Harvard trained. Completely different assessment of literatures and study versus what you're talking about, and you say it with a great deal of authority. Well, let me first, what is your opinion of these 3 gentlemen in front of us, these 3 doctors? I mean, this is not pejorative to you 3 gentlemen. Do you think they're just idiots? Again, you are very authoritative and completely refuting what these three gentlemen are talking about. I mean, this is the disconnect, and this is what America needs to evaluate, okay?
Yeah.
So, tell me what your opinion of these three gentlemen are here.
Yeah. So, Senator Johnson, I don't know these three gentlemen. They're all clearly well qualified. They're clearly smart, and I believe they're all clearly committed to the right issues. I have no reasons to doubt any of that. My problem here is not so much that we have a differing reading of the literature, which we clearly do. It is this idea that there is this broad conspiracy across, hundreds of thousands of doctors, the NIH, the CDC, all academic institutions, the Infectious Disease Society of America. We're all in on this conspiracy to prevent Americans from getting a life-saving therapy. As you might imagine, pulling off a conspiracy like that would be extremely difficult. Doctors and academics are way too disorganized to pull off such a thing.
By the way, I never use the word conspiracy.
I
Okay?
understand, Senator.
I don't think anybody on this, so quit using that word.
Okay,
Okay?
fair enough.
Something has happened where we have not devoted any time or energy or resources to doing what could have stopped this COVID crisis very quickly, and that's called early intervention, early treatment. Okay?
Yeah. So, Senator, I agree, and I will not use the word conspiracy, and I apologize if that was at all offensive. I didn't mean it to be. The point is, we have tried. There are ongoing randomized controlled trials of outpatient therapy. And what I have said literally from March when this issue first came up, and I have a long track record on this, is I hope this works. I pray it works. If it works, it's going to make a massive difference. The literature on this, it's not like no one has studied this. We've had multiple randomized trials, including some in the outpatient setting. They just haven't worked.
But again,
And
that is
just
so okay. So that's disputed. In your testimony, you came up, and I'm telling you, this is, I would consider disinformation and scare tactic. 93% increase in reports of poisoning, and then you heard what Dr. McCulloch talked about. We're talking about out of about 500,000 people that took hydroxychloroquine, another 77 called in, and about 2/3 of that was because they thought they maybe took an extra dose and they were concerned about it. So again, you use a scare tactic of saying 93% increase in poison of hydroxychloroquine when it's not even, it's an infinitesimal impact, but it's an enormous, and I would call it disinformation impact in terms of your communication.
Can I just have a chance to respond to that? First of all, I have never made the claim that this is the problem with hydroxychloroquine.
You made the claim that it was unsafe in your testimony.
Sir, yeah, I agree. Let me just finish that thought. I did mention the 93% because it is correct. I could have mentioned the fact that there have been more than 76,000 instances of toxicity reported to the WHO across the world from hydroxychloroquine during the middle of this pandemic. The bottom line is that every drug has some safety issues, including hydroxychloroquine. If it's effective, we should use it. To me, that is not the most compelling issue. Most of my testimony was about the effectiveness. Yes, I did throw in a statistic, which turns out to be correct, and I could use others, but I don't think we should focus excessively on that. I think we should focus on the fact that the evidence so far is very clear that this therapy doesn't work. If future data show that it does, I will be delighted and be the first to promote it, but I've got to be driven by the data and the science and not what I hope is to be true.
Well, again, there's a real dispute by the 4 members of this panel. I realize I selected 3 and Senator Peters selected you, but there's a real dispute. And by the way, these aren't the only 3 people that take a look at the potential risk-reward ratio here. Take a look at the observational success, the firsthand knowledge of treating people with success, and realize, really the risk-reward ratio would be in favor of give it a shot. And let me make this point, and then I'll turn it over to Senator Peters. I see he's back on screen here. I think me, as a human being, as an American citizen, with the freedom, with a bill that I helped pass now, right to try, should have the right to access this without the interference of bureaucrats in the CDC, NIH, and the FDA. And that is exactly what's happened. I can't get it. Millions of Americans can't access it because of the disinformation, the scaremongering,